Welcome to MedGate Today, doctor. Can I have your introduction?
Yeah, I am Dr. Arjun Goel. I'm department and head of surgery department in Sarvodaya Hospital, Sector 8, Faridabad.
Okay, so sir, I want to ask what exactly were the injuries sustained by the 21-year-old woman when she was dragged by the tractor, and which injury was the most life-threatening?
Yeah, actually she had a complex thoracoabdominal injury, which is very rare. If we look at the incidence all over India, it is roughly less than 1% of all blunt trauma abdomen, less than 1% of the total blunt traumas that are in combination with thoracoabdominal injuries. So it was a very rare and complex injury, and the chances of survival were of I think even less than 5%, because yes, definitely, because already a hospital that she had been previously visited to, they had refused her treatment, and they had asked her to yes, they had asked her to go away. And I mean, they were not able to, and they were very right. I guess they did not do anything wrong, because they did not have the facilities of that kind to handle such care of. Yes, definitely, that is how she got saved, I guess, because God has his own way. So they referred her to a higher center, and Sarvodaya being on her way, she reached here. And Sarvodaya has a very high reputation of treating and handling such complex trauma cases. So we at Sarvodaya Hospital Sector 8, when we received her, she was in a very bad condition of less than 5% chances of survival, and she had almost lost 40 to 50% of her blood, that is about 2 to 2.5 liters. So it was a very complex injury. She was unconscious. Yes, she was unconscious. We had to put her on ventilator instantly the moment she came to the hospital. And then our work starting with the emergency team. Everybody was on their toes, and immediately we took her to the CT scan rooms after stabilization, after resuscitation. And once her BP and pulse started to come up, because when she came, she was unconscious and she was not having any BP or pulse. It was unrecordable.
Okay.
Yeah.
Doctor, this thing that I want to ask, how critical was her condition when she first arrived at Sarvodaya, and was she in shock or at the risk of losing her life?
Yes, definitely. She was at the risk of losing her life, up to the percentage of 95% that I just mentioned, less than 5% chances of survival, because the rarity of this trauma, it is handled at very high trauma centers like Sushto Trauma Center or AIMS Trauma Center. Even there we have a very high mortality rate, because such cases rarely survive because of secondary complications like sepsis, wound infections, other comorbidities. So it was a very high risk case, and she was almost at the verge of her death. But by God's grace, me and my team, the team at Sarvodaya, including 4 to 5 departments, we managed to save her. And yes, she's very hale and hearty today. She's almost ready to marry now. Yes.
Okay, last thing, were there any internal injuries that were initially difficult to reach at that time?
Yes, definitely, because she had a complex thoracoabdominal trauma. So what happens is, basically, of the high pressure impact on the abdomen, all the abdominal contents, they come out into the chest. So there is a layer that separates the chest and the abdomen.
Yes.
That ruptured, that gave way like a curtain.
Yeah.
So it ruptured, and all the abdominal contents went into the chest. Plus she had
Whole internal
yes. The whole internal organs got shifted into the chest. There was almost a loss of 2 to 2.5 liters of blood, and obviously because the intestines got shifted into the thorax, because of the stretch, the intestines also lost their vascularity. They tethered, they tore away. So सारे के सारे जो आंतें थी वो फट गई थी, बिल्कुल चिथड़े उड़े पड़े थे उसके. So we had to manage her by complex procedures, that is laparoscopy and as well as a mini laparotomy, through which we brought out the deceased segment, and which was almost gangrenous, the useless segment, and reconnect the healthy segments.
Okay. So thank you so much, doctor, and thank you so much, Sarvodaya team, for treating these types of patients, and thank you so much for sharing your experience with us. Thank you so much, doctor.